And just to finish up with, I think sometimes it's just, you can't really, I think there's so much pressure on patients who have conditions such as cardiovascular disease. And I remember talking to you about a colleague that I had who he had a mini stroke and then eventually required a heart bypass as a sort of safety precaution measure. But the thing is, he was quite healthy. He used to actually cycle every few days a week for a couple of years. Obviously, he was in his 50s now. Obviously, his dad had cardiovascular disease and passed away from it. But he inherited that from his father. So sometimes you just you're just unlucky and you inherited some genes that increase the risk of developing disease. So sometimes I feel it's not your fault, because even though you can have a healthy lifestyle and take all those measures, you can just reduce the risk. It's still there. And I think there's so much pressure on people who think they need to do something when they're already doing enough. And it's okay to be where you are.
Yeah, in the end of the day, you can't run away from your own mortality. And so as much as none of us like it, we have to live our lives. We have to accept that, there are those modifiable versus non-modifiable risk factors, and do our best to address what we can, but know that, life and DNA catch up with you. And so in the meantime, we have to do the best that we can.
Especially if you've got a familial history of type 2 diabetes. I mean, there's a chance that you might develop it, even though you can do as much as you can to reduce the risk. You can perhaps slow down progression or prevent it from an early age. But I've seen in some cases where patients who've reported to have healthy lifestyles still developed it later on, which is still a pretty good outcome, because they actually spent the early years of their life actually preventing it. So they've had a good lifestyle, a good quality of life, until they've perhaps hit late 40s, 50s, where then, like you mentioned, life catches up with you. Perhaps it's your DNA and other genetic aspects that you can't really control. You can just reduce it, but it's still there.
Absolutely.